Welcome to the Frisco podcast. I'm your host, Scott Ellis, and today we are here with Dr. Canon Clifton from Kalypso Wellness Centers. Dr. Clifton, welcome to the show.
Thanks for having me on, Scott.
Good to have you on board. So we're here to talk about a subject that is near and dear to my heart. So one thing a lot of people don't know about me is I have a degree in psychology, and I worked in a clinical setting for a little while. Eventually got out of that, but it's still something that I think that experience gave me a different perspective on the topic we're going to talk about today, and that is depression and the treatment of depression. And so you have co-founded something called the Kalypso Wellness Centers, and you guys have, I guess, a unique approach to how you're treating depression and some of the success that you're having with that. So let's start there. Tell us a little bit about your background and how you got into Kalypso and treating depression.
Definitely. Well, I started off initially as a chemical engineer and actually worked for 5 years up at an oil refinery up in Minneapolis. Got to the point where somebody was going to have to start making the gasoline, but it just wasn't going to be me anymore. And at the time, my brother was in medical school, and I started talking to him, and I realized that, I really wanted to figure out how to get into medical school so I could still do science-related stuff, but maybe help more people. Fast forward a bunch of years and went to medical school and ended up doing residency and got my certification in anesthesiology and was practicing as a anesthesiologist in San Antonio for about 8 or 9 years. And about that time, my brother, who also decided to specialize in anesthesia, he had moved to San Antonio as well, and we were in the same group. And we started looking to say, okay, what can we do? We keep getting the subset of patients that need more help, whether it be chronic pain or depression or anxiety. In San Antonio, where we practice, there's a lot of veterans that have PTSD. And we started coming across this research of patients that would get low-dose ketamine infusions that was having pretty remarkable results. And so then we started talking to some other pain physicians that are now our partners, and they said, yeah, we've heard about that, but we just don't have time to kind of explore it more. And so my brother and I said, well, we'll make time out of our anesthesiology schedule, and let's start seeing some of your patients. And so we saw 10 of their worst pain and depressed patients, and remarkably, 9 out of 10 of those patients got way better. And we said, man, we might be onto something here to get a new, type of treatment for these patients. And so then from there, we said, well, let's do all the research. Let's see what's going on. And one of the things we found was that, unfortunately, the medicine itself, ketamine, while it's highly effective for helping these patients, it also had a pretty bad side effect profile. The literature states that 40 to 60% of patients, can't tolerate getting the infusions, and we found that for our first 10 patients, almost exactly half of them said, boy, that really helped me, but I don't know if I want to do that again. In medicine, there's an old joke that if I come up with a cure for cancer, if it causes Alzheimer's disease, not a very good cure.
Right.
So that's when we said, well, let's go back to the drawing board. I mentioned I was a chemical engineer. We started looking at more of the organic chemistry literature. One of our partners, Dr. Mark Moran, he's got a master's in pharmacology. My brother, I mentioned, he's always just been kind of a research nut. And so we started looking at all different types of things that we could say, what can we add in to help with the ketamine to make it either work better and maybe more importantly, have less side effects. And, I'm sure we'll talk about it here in a bit, but that's kind of how we got going and started Kalypso. Again, it was purely out of that there's got to be something better to help these patients with their depression, anxiety, PTSD, their chronic pain, their migraines, fibromyalgia. And, from there we were kind of off and running, and that's, I'm here talking with you now.
Okay, so are you guys... Is this your full-time focus now, is the Kalypso Wellness Centers, or are you still a practicing anesthesiologist?
I'm still a practicing anesthesiologist, as is my brother. The other two founders are still practicing traditional pain management, but essentially we're working 2 full-time jobs, and our goal would be is hopefully one day we could switch to just doing Kalypso full-time. There's way too many patients out there that need to hear about it, that need this treatment. There's way too many physicians and people in the medical community that don't even know about this treatment that need to be educated too. So that's the goal, is hopefully we can get to it so more people can get access to this.
All right, so it's already opening up a whole bunch of questions for me. The first of which is, what were the side effects that was making the ketamine treatment so hard on people? What were they experiencing?
Well, first, just a little quick background on ketamine. It's actually a very old medication. It was invented in the 60s, and we use it as an anesthetic all the time. In fact, the World Health Organization lists it as one of their core medicines in the world. So it's a very safe, very effective anesthesia agent. What we use it for is that we give these patients infusions of the medicine over an hour in really low doses. So it's not even enough of the medicine that you could do a procedure on them like a true anesthetic if you had to get a surgery or some type of procedure. The problem with ketamine is that it has a very dysphoric, out-of-body type of experience. Some patients state that they get some hallucinations, and a lot of people don't like that feeling. And in fact, when we use it as an anesthetic, we actually give patients a very powerful amnesia medicine as well, so that way they don't remember having that kind of out-of-body experience where they have these kind of weird hallucinations and don't like the way they feel. Even at these low doses, these patients still were getting some of those side effects. And that's when we said, okay, if they can't tolerate it, then there's no use in continuing with this medication. And now what we did is, again, I mentioned earlier about the different research we did. We found other medicines that we use commonly that we can mix with the ketamine. And I can't stress enough, the ketamine is the main medicine that's doing all of the benefits. It's helping the patients. But these other medicines greatly reduce the side effect profile that now all of our patients, they still say it's a weird experience, but nobody says it's a bad experience anymore.
Not enough to keep them from wanting to continue or to have the treatment.
Correct. And everybody's always a little nervous about coming in the first time because usually they know nothing about ketamine, or if they have heard of it, they usually have heard of some of the bad connotations with ketamine.
And I was going to ask, I know that for those that have even heard the word ketamine before, they may have an association with it being used illicitly or in some other way that's recreational but not advisable. So how do we get people more comfortable with the idea that this is a drug that we can treat these problems with and you're going to be okay?
Yeah, it's all about education, and surprisingly, not just to the general public, but even to my other healthcare colleagues, because unless you're an anesthesiologist or maybe an emergency physician, most people learned about ketamine for just a couple days their first year of medical school, and then they forgot about it. The problem that most people hear, the negative connotations, is they say, well, isn't that a party drug, and isn't that a horse tranquilizer? And the short answer is yes. But then I always have to explain that any type of substance or medicine can be abused. People abuse caffeine. People abuse alcohol. People abuse, the opioids that we prescribe for pain. So and they're taking those in much higher doses than what we even give as true anesthetics in the operating room.
Wow.
The other big one, I think that is a worst connotation with it, is that when people ask me about it being a horse tranquilizer, and because they throw the word horse in front of it, people think, oh, this must be super powerful. It can't be, it must be too strong. And the truth is that vets use ketamine all the time for the simple reason that we can also give it as almost like a flu shot intramuscularly. And that's important because we use that for children all the time too, because what kids and animals don't let us do is start IVs on them. Mm-hmm. They don't like needles. But when you give it intramuscularly, then the child, the adolescent, or the animals will start to calm down, and then you can do what you have to do to them, or you can then start an IV and do the procedure. And the key part of this is that the reason why ketamine is so safe is it's our only anesthetic that actually increases your heart rate a little bit and increases your drive to breathe a little bit.
Interesting.
So that's why it's great for the vets, because animals, as a general rule, are harder to maintain their airway, keep them breathing than they are with humans. And so this actually helps them out so they can do their procedures. So usually anytime that I'm talking with somebody like you, Scott, or giving a talk, or we're talking to patients to come in for a consult, then I explain this to them and they say, oh, that makes a lot more sense now. I understand, why people say these things about ketamine. And actually it turns out, like I said, it's a very safe and very effective medication.
Okay, that's good to know. For those of us that like to kind of nerd out on these things a little bit, and we won't go too far down this rabbit hole, can you describe what is it that ketamine is actively doing that is helping alleviate symptoms of, say, PTSD or depression?
Yeah, well, you may take me down the rabbit hole because I love to nerd out about this stuff. But in short, it's got four main things that it does. The first thing that ketamine does is it's a very potent anti-inflammatory medicine. In fact, it may be one of the most potent anti-inflammatory medicines that we have at our arsenal, and that's very good for anybody that has any type of chronic pain. There's usually an inflammatory component. And just recently, they've also linked inflammation and depression together. And they're not sure if the depression causes inflammation or if inflammation causes more depression. So it's certainly going to help with that aspect as well. And that's been new here just in the last 3 to 5 years. They've pieced that together. Number two, just from the pain side of things, ketamine targets a specific receptor in your body. And again, here's the nerdy part of it. It's called the NMDA receptor. And the only reason that's important is because all of our other pain medicines mostly target a different receptor that's associated with morphine-type medicines. And so therefore, when patients are exposed to ketamine that have chronic pain, usually it's a novel medicine their body's never seen before. And so they have a profound reaction to it that helps them to start to feel better almost right away.
Makes sense.
Yep. So that's great for those patients. Back to the mental health side of things, depression, anxiety, PTSD. The medicine also targets a receptor in your brain called the glutamate receptor. And that's really important because glutamine is one of the main excitatory amino acids in your body. That's great if you're taking a test or running from a bear. It's not great when it's time to relax and your brain needs to sleep. And you talk to any patient with depression, with anxiety, PTSD, they feel like that even if they're going to sleep, their brains are still running a mile a minute. And so this medicine helps to truly calm their brain down and start to quiet things down. And the last thing that the ketamine does, and this is what I think is the coolest part about the whole thing, is that the medicine actually helps for new nerves to regrow and synapse that don't have the memory or the imprint that I've got chronic pain, chronic depression, chronic anxiety, fibromyalgia. And, we've actually got research studies now and functional MRIs that have shown that the ketamine helps to stimulate these new nerves to start growing faster and connections together while we're blocking all those receptors I just talked about. So that way the patients, get hopefully truly longer-term benefits and relief and not just a transient type of medicine. So in a nutshell, hopefully that wasn't too nerded out, but that's what it does. And I love talking about it because, again, it's just for the patients that get these treatments, it's been life-changing for them.
No, I think that was a great description, and I think at a high enough level that most of us can still relate to it or understand it anyways. When somebody comes in for treatment, how long does that treatment take, and then how long does it last? How frequently do they have to come back? Things like that.
We get asked that all the time. It's a great question. So 2 answers to that. One, at Kalypso Wellness Centers or any of our managed partnered facilities, the infusions themselves are exactly 1 hour. There's about 15 to 20 minutes beforehand to fill out some standard vetted out questionnaires that everybody fills out beforehand. And then there's about 15 to 20 minutes afterwards for the immediate effects to kind of wear off and, get you so we can get you to go home in a safe manner. How long do the treatments last is kind of dependent on the severity of the patient's disease state, how long they've had it, what other treatments or medications they might be on. We've done so many infusions now, though, that when patients come in for consults, we have a good idea that we say, hey, look, we know you're going to need 4 to 6 treatments kind of right off the bat. And then at 3 to 6 months, you may need a maintenance or booster infusion, and then maybe another one at around a year mark. And that's the majority of our patients is the protocol that they follow. We certainly have some patients, though, that come in and get 1 or 2 treatments, and they're doing way better, and they say, hey, we'll come see you again if we need to. We also have a subset of patients that have either been maxed out on narcotics or they've had all the surgeries they could have, or from their depression and anxiety, they've tried every antidepressant, they've tried electric shock therapy, they've seen every type of therapist and psychiatrist, and nothing has helped. And this is the only thing that helps them. For those patients, they say, hey, we would rather not get back on more medicines with more side effects and come in and see you guys, once every 2 or 3 months for an infusion, because then it takes away all my anxiety, all my depression, all my, thoughts of suicidality. And so we have a small subset of patients that do that as well. So the key, though, is that every patient's different. We know that when patients come in for their consultations, we want to talk to any of referring physicians that they may have that send them over. We want to discuss what medications they're on currently. We want to discuss what their goals and plans are. Do I have time to tell a quick story?
Yeah, by all means.
We had a patient that came in, and he was a grandfather. He was 78, and he had chronic pain. had 2 failed back surgeries, maxed out on narcotics, and he said his grandson was coming into town, and he heard about us, and nothing else helped him, so he wanted to try it. So he got an infusion with us on Wednesday. His grandson was coming in on Friday. We said, we're going to call and check on you like we do all our patients. And we called him on Monday, and we said, how you doing? And he said, oh, man, I had the best time ever. I took my son to SeaWorld. We went to go out to go play. He loved that we got to go to the park, and I just hadn't been able to do that one for years. We said, that's great. That means you're responding well to the medicine. We know you've had 2 failed back surgeries and you're maxed out on narcotics. You probably should come back in, and that way we can give you longer-term relief. He said, no, I'm good. I'll just come in next time my grandson comes in town next year or two. And we kind of chuckled because, that's all he wanted to do was to, come in for, that one short time when his grandson was in. So my point is that different patients have different goals, and we want to work with them to achieve what goals they want to have, but also give them the maximum benefit.
So if somebody is on, I guess, what I would consider a normal or typical protocol, in the beginning they're coming in more regularly for a while before they go into the maintenance mode. Is it monthly, weekly, every 2 weeks? What's the schedule typically look like for somebody like that?
There's the medical literature that's out there, and then our empirical data that we found too has been that usually you want to get a block of infusions closer together at the beginning. We found that usually as long as you get an infusion in about 7 to 10 days or less, then you get the chance for the most and longest benefits.
Okay.
So most of our patients, if they need 4 to 6 infusions, they usually get 1 or 2 infusions a week for 2 to 3 weeks. And then after that, we say, okay, let's see how you do for a month or two, because that's when those new nerves are regrowing and resynapsing, and see how their benefit is. And then again, we check in again about 3 to 6 months, and that's when they may need to come back for another maintenance dose. But most of the time, they usually get the block of infusions within the first 2 to 4 weeks of them coming in for their first treatment.
Okay, that makes sense. What sort of success rate do you see with people? I know from experience that different people react differently to different types of treatments and medications. Not everything works for everyone. How well does this work overall for people, especially those that have maybe tried other things to treat their condition and they just haven't had any success so far?
So for us, we've done a little over 6,300 infusions now since we've started Kalypso, and our patients, we have an 85 to 90% patients saying they're getting the benefit that they wanted. This isn't us leading them with questions. We have, again, both questionnaires they fill out before their infusions that we track, and these are nationally vetted questionnaires that deal with depression, anxiety, pain, and we track those numbers. And then after their infusions, again, we have a survey that we follow up with. It's just a question, 1 to 10, do you feel happier? Do your medications working better? Do you get any more sleep? And then they answer those questions, and they're not even any of the physicians that call and ask these questions, so that way we can't be biased. So 85 to 90%, which is huge in medicine. Mm-hmm. I'd like to point out, too, that in most of the medical literature out there for any research or any studies or other places that are giving these ketamine infusions, usually they mention around a 60 to 70% benefit rate. Now, that being said, we're certainly proud of the work that we're doing, and that with our formulations, patients seem to be getting more benefit than just getting standard ketamine. But I'd like to also stress that, again, there's lots of patients that could benefit from this, and even 60 to 70% benefit is huge in medicine.
Yeah, absolutely.
I think the bigger difference with Kalypso, which I think you were going to get to here in a second, is that back to that side effect profile. And a 40 to 60% side effect profile where patients can't tolerate it, that part is terrible in medicine. In fact, most of the time, we like anything, if there's going to be some type of side effect, or if a patient asks, hey, what's my chances of this happening in a surgery, we like 1 to 2% or less. And so with our formulations now, we've gotten our percentage of those side effects down to that 1 and 2%. Our biggest side effect now is some patients get a little nauseous, and we give patients, unless they have an allergy to it, a anti-nausea medicine beforehand, and so therefore our side effect profile is now essentially down to 0. And that's just phenomenal and great because, again, as we talked about at the beginning, if patients don't want to come get this infusion, or they feel like it makes them feel so bad afterwards, or they have these bad side effects, then they're not going to even give it a chance to get their benefits.
Yeah, no, it's great that you guys have managed to find ways of mitigating that as much as possible so that people are getting the benefits without that sort of negative side effect that might prevent them from wanting to continue with their treatment. I want to shift gears a little bit and talk about all of those people that would potentially benefit from this, but maybe don't know about it, haven't had access to it yet. If I know someone that has PTSD or depression or anxiety, and would like them to consider this, how do I begin to educate that person, help them get connected with you guys one way or another so that you're having the opportunity to treat as many people as possible?
Yeah, that's a great question, because we've had lots of friends, family, patients that have said, I got this uncle, I've got this cousin, I've got a friend of a friend that they could really benefit, and I don't know how to get through to them or what's the right way to do it. So the internet is a great thing, and also cannot be a great thing, right?
Indeed.
Yeah, everybody thinks if they go to Google, then they've become an expert, right? But the good thing is that if people truly just Google or put in there, ketamine infusions, low-dose ketamine infusions, tons of stuff is coming up now, because it seems like there's a new article every week that's coming out talking about some of the benefits. For us specifically, at all of our Kalypso managed partner locations, we give free consultations. On our website, they can send in either anonymous or their name and say, I want more information. We can get back to them either by phone, email, send them literature. They can certainly stop into any of our clinics and ask for information. Our biggest thing is that we want to educate the patients. We feel like that an educated patient is somebody that is going to do better. They're going to feel more empowered about their ability to get their treatment. We don't want to leave any stone unturned when we're talking to patients, and we'll go back over and over again the same things we talked about earlier. About what's the side effects. I've heard bad things about ketamine. Why isn't more people offering this? And so we truly want the patients to be as educated as possible. So go to the internet, have them call us, have them check out our website, go to any of our clinics, and the more conversations we have, the better.
Do you guys work with other referring like psychiatrists or psychologists or other organizations? Like we have a lot in Frisco. There are a number of organizations here that work with veterans in different capacities. If they are identifying somebody that maybe has PTSD or is at risk in some way, suicidal, do organizations like that have a path to easily reach out to you guys and try to get you connected with the people that would potentially be a good patient?
Yes and no. We've tried to reach out to a lot of these organizations, and there's I'd say several. There's many that are national organizations. There's some that are just specific to different cities and states. I think the issue is that a lot of the patients or these groups are a little leery, because maybe something we should have talked about in the beginning is that these low-dose infusions we're using them as considered an off-label use by the FDA. When we use it as an anesthetic in the operating room, it's FDA approved, but in this setting, it's considered off-label use. So therefore, insurance doesn't readily cover it. Other people that might send us patients and send referrals then are leery, because they say, well, if it's off-label FDA use, then there must be something wrong with it, which is not true. In medicine, we do lots and lots of things that are considered off-label use. And so we're trying to keep it, again, back to the education piece to explain what it is we're doing and how we're doing as much as possible. But for any of those organizations, we've tried many times and will continue to try, and that we want to reach out to them. We want them to reach out to us. How can we help? How can we see the people you're seeing that need this help? Again, especially in San Antonio, it's a big veteran city that we've got lots of military bases and a VA system. And so any way we can reach out to those people and help them, we're happy and want to do to help them out.
Yeah, makes sense. And I think there are a lot of use cases for medicine. I mean, that I, even as a layperson that I know of, where a medicine was designed for one thing, but it's then treated for something else. And I think that's fairly common, but people don't always recognize that. So I'm glad you made that point. Okay, so you guys started in San Antonio, correct?
Yes, sir.
And you've expanded out into some other places. I know that there is a Kalypso Wellness Center in Dallas, but for our folks here in Frisco, that's our main audience, Frisco and surrounding cities, is Dallas their best location, or is there another place that they can go to get treatment or to connect with you guys at least?
No, definitely in Dallas is their best spot, and we're super excited because we just partnered with a new group of physicians here in the area, and they're called Principal Spine and Wellness. It's Dr. Paul Kurian and Dr. Arpan Desai, and again, their background is pain management doctors, but then have also been doing their own research about ketamine infusions. It's interesting, we were talking earlier about the depression side of things. We see lots of patients that have depression that have no component of pain, but almost every patient that has chronic pain has a component of depression and anxiety because they're always sick and tired of feeling sick and tired.
That is completely understandable.
Yeah. So Dr. Carey and Dr. Desai reached out to us and they said, hey, you guys have kind of been pioneering this treatment, have these protocols set in place. We'd like to meet up with you and see if we can kind of work together and have this partnership. And so just recently, we've partnered with them and they're providing Kalypso Wellness Centers infusions at their office, again, Principal Spine and Wellness. And that's a great resource for all of your listeners to go to. Again, they do free consultations. They can call and reach out to them. Hey, we just got the question about this, or we want to hear more about, we heard on the podcast that Dr. Clifton mentioned this. Can you explain that some more? And they'll be happy to talk with them. And again, I can't stress enough how excited we are to have a presence here in Dallas. There's a large veteran population here in Dallas as well. And again, being a super large city in Texas, there's thousands, if not millions, of patients that could benefit from these treatments.
Yeah, absolutely, and it's definitely something that we want to. I'm happy to have you on today because I want to get the word out that there is another path for people that have one of these conditions, want to treat it, especially if they haven't had success trying other things. This is going to be new to a lot of people. So let's make sure that they're aware that this is an option for them and it's something worth investigating. It sounds like you guys are having tremendous success with the ketamine infusions.
We have, and it's great. And you just kind of hit the nail on the head that almost all of our patients are patients that nothing else has worked for them. Again, they've tried every medicine, they've tried every surgery, they've tried every treatment. Most of these patients don't even want to go see a physician anymore because the physicians just think they're quote unquote crazy because nothing works. And it's interesting, we found that all of these patients, while they're unicorns in themselves because they're all unique, we found at Kalypso now we call it a herd of unicorns because they're all individually unique, but they're all the same in the sense that nothing's worked for them. And so when we talk to these patients, again, we are always forthright and tell them that, again, if we're getting 90% success rate, that means that there's 10% that this may not work for them. But we're giving them hope again. And that's an important thing, too, that these patients, feel like that nothing's ever going to change. And what keeps me going and excited about coming and talking with you and educating people and talking about ketamine infusions is that we have patients all the time that come back to us and say, you got my wife back, you got my son back, I can go back to work again. I don't want to kill myself again. I mean, that stuff is super powerful. And I can't stress enough as a physician how rewarding that is, and in fact, this has been the most rewarding thing I've ever done as a physician. So
I can't even begin to imagine how much so. That's got to be the case. So I want to close off with two things. First, let's start with directly talking to the people that would benefit from this. So we've talked about depression, we've talked about PTSD, anxiety, and chronic pain. Is there anybody else, any other conditions, people that we want to say, if you are suffering from this, if you've tried other things for X, Y, or Z, give us a call, at least come talk to us. We would love to try to help.
Definitely, and those are the main kind of big umbrella diagnoses, but we've actually helped treat 32 different disease states at our Kalypso centers. And some of the other big ones that patients come to see us for are migraines. I didn't realize how debilitating it can be with patients that have migraines. This helps them with that. Patients with fibromyalgia, again, and that's another one of those kind of weird diseases that the medical community, even until recently, used to think was kind of a made-up deal. And until you meet these patients that have fibromyalgia, you realize that this is a really true debilitating disease that is ruining their lives and they get no treatment. And we have a kind of a class of what we call the weird diseases. I joked about unicorns earlier, but while we're not going to cure any of these diseases, lots of these different diseases, these patients have severe symptoms of depression, anxiety, pain, and we help with those symptoms. And those diseases are things like ALS or Lou Gehrig syndrome, multiple sclerosis, Lyme's disease, lupus. Again, I want to make sure we're clear. We're not going to cure any of these diseases, but we can help out a ton with the symptoms and the severity of their disease states. So the kind of two big umbrellas you can think of is patients that have some type of pain component, whatever that may be, and the mental health side of things, which again includes depression, PTSD, bipolar disorder, OCD. So almost everybody knows somebody that has some of these symptoms. And again, most of the time this isn't considered a first-line treatment, but it certainly can be. Most of the time our patients are the ones that, like we've talked about, that everything hadn't worked and then they come to see us.
So I'm going to come at you out of left field with this one. You talked about it helping nerves grow back or nerve connections get made. Is there any benefit to somebody with a neurodegenerative disorder, like or things that are related, like a Parkinson's or like dementia and Alzheimer's, things like that? Is there any benefit to those patients, even with symptoms with ketamine? Just curious.
So there hasn't been any studies that have come out yet that have helped anything with Alzheimer's. There has been a couple studies that have said that it has helped patients with Parkinson's disease, but it's been more from the mental health side of things that they feel like they can, okay, I've got this terrible illness. I can know how to deal with it a little bit better. For neurodegenerative types of issues, what we always tell patients when we talk to them is that our medicines are never going to fix a true mechanical injury. That being said, there's lots of patients that have partially herniated discs. They have issues where nerves are partially impinged upon, and we talked about the anti-inflammatory properties. So those patients are great candidates, and what happens is we have lots of patients that they go to see a neurosurgeon per se, and they're kind of plus minus on whether they want to do some type of spinal surgery. And so the patients will try our infusions first, and a lot of times then they don't need to go get surgery. We've also had patients that they tried it, and then it turns out that their mechanical injury was too great, so they get the surgery. But then the cool thing is that we're hearing feedback from the spine surgeon saying that our patients that came and saw us first, they're recovering quicker, they're requiring less narcotics in their post-operative stay, they get out of the hospital quicker. So in that sense, it's kind of a win-win anyway if they ended up having to have surgery, because they're getting more benefits and having less side effects once they get their surgery.
Fantastic. All right, so let's make sure, we're going to kind of go out on this one. I want to make sure that people know how to find you guys, how to reach you. So if people want to learn more, if they want to connect with Kalypso Wellness Centers, tell them where to go.
Here in the Dallas area, we want you to go and call Principal Spine and Wellness. Our national website is www.kalypsowellness.com. You can give us a call at 1-800-RESET-20. No matter where you're at in the United States, you can get routed to the closest place to where you live. And we hope to hear from you because, again, if you just want information, we'd love to educate you. Let us see how we can help you out.
And that's Kalypso with a K. And we'll have all this linked up. All the information will be in the show notes. So if you're listening to this podcast, definitely hit those show notes and connect with these guys if you or somebody you know could use their help.
We appreciate it. We'd love to talk to anybody.
Dr. Clifton, thank you so much for joining us today. You guys are doing great work and really appreciate it.
Thanks for having me on. I appreciate it. Thank you, sir.
You bet. And to all of you who are listening, thank you very much for tuning into the Frisco podcast. As always, please be sure to subscribe to us on iTunes, Google Play, Spotify, Stitcher, and anywhere that you guys are out there listening to podcasts, because we're all over the place now. Thank you very much for tuning in, and we'll talk to you next time.